Watkunuradu, and welcome to our daily COVID-19 Task Force update. I'm Joe Delarone. We have plenty on the program today being Wednesday, March 25th. It's about 4:30. On the show today, we have the usual cast. We have Lloyd, Phillips, and Lisa Westaway, but also a few other people, including a couple of people from the Mohawk Council of Kahnawake. We have some big news coming up. If you haven't heard it already, it'll be explained more in detail in just a little while. But first of all, we'd like to welcome, as we do just about every time, the Commissioner of Public Safety for the Mohawk Council of Kahnawake, Lloyd Phillips.
Thank you, Joe, and welcome once again, Kahnawake Dono. Appreciate the time for you to take to tune in to our broadcast, and as always, we're trying to keep you up to date on some of the latest developments in and around our community. First of all, we just mentioned to you that we just finished a COVID-19, Kahnawake COVID-19 Task Force meeting, where we got really good updates from all the key sectors within the community. And I'm glad to say that the situation in the community is moving very well. Cooperation throughout organizations, throughout the community, with community members, business people coming together. I think we are in a much better place than pretty much anywhere across Canada. One point I want to address is yesterday we had confirmed the fact that there are positive cases of the COVID virus within the community. And and that was a fact, and it is a fact. But what we want to also say is it's not something that we did not expect. We did expect positive cases, and we are also expecting them to rise. So with that said, we're not going to be broadcasting every day that there's 5 cases, there's 6 cases, there's 10 cases. What we have to do as a community is realize that the virus is in the community. People are going to contract it, and the numbers are going to rise. We don't want to put a spotlight on individuals in the community, and we don't want to put a spotlight on Kahnawake and reporting how many cases we have. It's not happening anywhere else across the province. And a matter of fact, the numbers that we get, we do not get specific, these are Kahnawake numbers, these are Chattagee numbers, or these are St. Constant numbers, our neighboring communities. All the numbers are in regions broken up within the province of Quebec, and we're in the area called the Montour, which is a huge area which runs all the way from like Ormstown all the way up to Longueuil and towards the border. So it's a very large area, and so you'll see numbers per region. So we don't want to put a spotlight on individuals and in our community. So we're not going to be reporting those numbers. Plus, like I said, we don't really get those updates in that much of a detail. What we can say is for people to heed the precautions. We talk about social distancing is one of the biggest ones. Making sure you're taking care of your health overall. You stay healthy, you stay rested, you eat well, and so on. You keep your immune system as strong as possible, and those are things that you could do to help yourself. With that said, we did have a really good updating session today. There was some really good positive information that we want to relate to the community, because not everything is despite the negativity of the overall situation of the pandemic, there are some positive developments that we want to share with our community that will help ease some of their concerns. And some significant developments in which and follow-ups that from directives issued by the COVID Task Force. We have 2 or 3 coming up, so stay tuned. And here is, for one update, here is Derek Montour, Executive Director of KSCS.
I offer my greetings to all of you as my brothers and sisters. I hope all of you are happy, healthy, and safe. I want to be quick today. It's really just to focus on our recently launched emergency food services that we're offering to the community. You've been hearing a lot about it in news. I was actually on K103 this morning to talk about it. We've launched it yesterday. Our intake lines are open. We're actually up to approximately 60 people that have signed up to it. and I wanted to mention just the process to make sure everybody's on board or understands, just so that if you have any questions. There's 2 types of services, a hot meal service and a food basket service. The same number to call to register yourself is at KSCS. Ask for the food service intake, and they'll direct you from there. Remember that our focus is 2 types of clientele. The hot food services are for our elders or those with limited mobility or dietary restrictions. So you'll be geared towards that, and it'll be a lunch meal and an evening meal that we're going to be offering. It's through the partnership of Playground Poker and the Rail. I want to say shout out my thanks to that company and the ownership partners of there who've stepped up and are going to be entering a contract with us to provide that service. They're going to be handling all of the food purchasing, storage, and preparation. And I want to put a shout out to the medical transport team and others who have volunteered to help transport all of those meals. We're using the GPS system to get it to the right addresses, so the system is going to be in place, I think, as of Friday the 27th. The second stream of service, again, delineated from the intake team, is going to be a food basket service. We're partnering with the Kahnawake or the Cattery Food Basket Committee, and they've now consolidated their service with ours, or shortly will be. It's going to be run out of Cattery School. I want to shout out to Cattery School and the KEC, as well as the Cattery Food Basket Committee, that to thank us for this partnership. But we're collaborating, and we're going to be offering it to those clientele as well, and anyone else who is capable of producing their own meals, cooking their own meals. The individuals who were on the Cattery Food Basket list do not need to sign up again. You're already registered as a result of being on that. Any new families who are in need of food due to low income will be geared towards that. I want to give another shout out, or a few shout outs. Number 1 to Mohawk Council. They announced today that they're going to be offering support for both of those initiatives, so $25,000 each. I want to thank the Chief and Council for that donation. I want to also thank all the community members, business partners, and others who are coming forward with giving food, wanting to donate funds, wanting to donate vans, their own time. Thank you all, community. You really come together just as I would have hoped, and that we all expect in these times of need. With that, I'm going to keep it that short. Really, if you have questions, you're more than welcome to call our intake and ask support. If you're interested in volunteering, give us your information, and we'll try to connect you, and assuming we can move it. Stay safe, and remember to hug your families whenever you can. Now, go.
Good afternoon. So I'm Lisa. I was told I should introduce myself, but you all know who I am by now. I just want to give you a little bit of an update today regarding public health and their role within this whole health crisis and epidemic. So public health, just to explain the process, once a positive is identified, what public health does is they contact that person who is positive, and they do an analysis of all the contacts that individual has had. Whether if that person is a healthcare worker, they'll look at all the contacts patient related, they'll look at work colleagues, and they'll look at possible social contacts. Their role, once they create that list, is to contact those individuals and establish what the level of risk is for each of those individuals. Therefore, they may ask a lot of questions about the type of contact that you had with a positive individual. So it's important to understand that there are very clear guidelines about what level of contact is. So a close contact is assessed as being more than 10 minutes within 6 meters of an individual. So 2 meters, 6 feet. So more than 10 minutes within 2 meters of a person is considered to be a close contact. They're going to evaluate what type of contact you had with that person, what your level of risk is, and whether you need to self-isolate or not. And they'll do this with every individual. If you're self-isolating, then they will monitor your symptoms as you go through your 14 days of self-isolation. There are different ways that they may monitor that. It may be with phone calls to you directly, it may be through email, and it may be through you completing forms that you send back to them on a daily basis. They're going to discuss that with you and establish the best way to monitor symptoms with you. So they provide that support. So again, just to say that when we pass somebody in a grocery store and then we find out later that that person may have been positive, that is not going to be evaluated as a close contact. Working in the same building as somebody who is positive, but yet you were, in your own independent offices and you were on different floors is not going to be considered a contact that puts you at risk. So those assessments are done by public health. And all of the organizations that are considered essential right now, and therefore for employees that are at work, we have clear guidelines as of today about how to also evaluate level of risk. So your employer should be able to help you if you're concerned about whether you should be able to work or not, depending on the level of contact that you may have had with a person who is positive or a person who may be under investigation, meaning waiting for results from a COVID-19 test. So it's important that, so we actually are all following these same guidelines. One thing that I wanted to mention, which is really important, is that public health does not have all of the information yet, but based on the information that they do have up to today, they believe that there is a possibility that Kahnawake is considered community transmission. So if you remember, what that means is that we are no longer able to establish the source of the contact. So it's not just people who have traveled necessarily who have COVID-19. It could be people who, in fact, we're unable to establish those who are positive where the contact happened. So there's not a unique source. What that means, and we've said this many times, but what that means is it just reinforces the importance of maintaining our distance within the workplace if we are working, practicing social distancing or physical distancing. Some people don't like the word social distancing anymore, and they're changing that, but it means the same thing. We keep a 2-meter distance from people at all times, and within our home environment, that if we're asked to self-isolate, that we remain separate from the rest of our family. That's very important. And again, all of those documents are on the COVID-19 website, which is the sub-website of KMHC. Also really important, I don't know if you've seen in the news, but New York is considered the epicenter of the COVID-19 transmission within the United States. So we know that we are at an increased risk because of the number of people who travel back and forth to the United States. So New York and the United States in general is really showing increased numbers, and we have to be especially careful because of the timing. March break and many people who go back and forth from the United States to Kahnawake, we have to be especially careful to remain at a distance from people. So I bring that forth again. It's especially important. If there's community transmission, but we have control. So if we are keeping our distance, if we're staying home, if we're self-isolating and social distancing, then we're not transmitting, and we're having an impact on stopping the transmission as much as possible. So we have that obligation as individuals to be able to impact the collective. We have control over that. So that's the update I wanted to provide you with today. Thank you.
Right now, Lisa Westaway, the Executive Director of the Cattery Memorial Hospital Centre. As we stated earlier, some big news today. Many of you may have already seen the press release that has been issued. You may have heard it on the radio. But now, to give you further detail on today's big announcement, we'd like to welcome Ietsenhaienhs Gina, who is finally back from isolation. She was one who did do some traveling a little while back, but she's back and able actually to do this personally. So let's welcome her with today's big announcement.
So we have a bit of good news in all of this, and today I'm fortunate, to be able to be here and share that good news. The Mohawk Council today has passed the $9 million, what we are calling the Economic Relief Measures Fund. So what this is monies that will go into the community for people who are affected by the shutdown of all the businesses that we have in the community. It'll help the individual persons as well as help the businesses. It is very important that we are doing whatever we can at every level, and there is a financial aspect to all of this. So today, this fund is actually meant to bring some sort of, easement on the pressure for people about what are we going to do about money, food, and things like that. So with this $9 million being injected into this pandemic situation, people are going to have access to dollars and to food. You heard Mr. Montour earlier talk about the fact that the food bank is going to be receiving money and the KSCS food program is going to be receiving money. So the individuals that are looking to have some information are going to be requested to call client-based services. We are emphasizing do not go there. Please do not go there. You are to call the 450-638-0500. And if you're a business and you want to make some inquiries, call Dewa Dunizakta. Again, please do not show up there. Give them a call at 450-638-4280. And people there will direct you as what to do and what the next steps are. So this fund has been created in a short period of time. We are trying to ensure that it covers all of the basic needs for individuals. The details are still being processed and worked out as we speak, but we do have a large amount of it covered right now. I am going to introduce our Business and Economic Development Officer, Paul Rice, who can share a bit of the details with you. Paul.
Good afternoon, good evening. This morning, Chief and Council, via Mohawk Council Executive Directive by resolution, put together in context of the emergency preparedness law, they empowered a board of individuals to oversee, the distribution of this $9 million economic relief measures fund. The individuals, is a mix of portfolio chiefs, relevant portfolio chiefs under social affairs and economic development, Gina Deer, Mike DeLille, Ietsenhaienhs Sky Deer, as well as Alexis Shackleton, who's in charge of client-based services, and Barbara McCumber, who's in charge of Dewa Dunizakta. It's important to identify really the three areas that we want to focus the funding. The majority of it is on, obviously, the individuals, and we expect an increase in terms of clients at client-based services. So what we're recommending to community members is to contact them by phone. And really what we're going to do is we're going to do our best to make sure that you're eligible for a variety of programs. A big one that's come out recently, just today, the federal government announced a $2,000 a month Canada Emergency Response Benefit. So we don't have a lot of details on that right now, but we want to make sure that as many community members as possible will have access to that benefit. So anybody who receives payment, a GST payment during the year or a child care benefit, we don't know the details right now, but we're assuming that you would be eligible if you have been impacted by COVID-19. Of course, other individuals may be covered by employment insurance and a variety of other benefits, and we intend to distribute that information in terms of eligibility and how to contact the various sources soon. If you're uncertain about your income right now, please contact client-based services. The social assistance run for the month of April is coming up next week. And if we need to, we'll do multiple runs, throughout the month of April to ensure that, as individuals sign up, that they're receiving, cash in hand income during this uncertain time. For the businesses, in somewhat of a new thing, please contact Dewa Denizakta. We've set up what we're calling business interruption assistance. And we want to make sure that, with the measures being put in place for COVID-19, that especially small and medium-sized businesses, but all businesses who are impacted will receive some assistance. And we're really talking about, how can we help you keep the lights on, make sure that business, once we've gotten out of the situation that we're in now, we want to make sure that your business is there and ready to open, and that the economy keeps humming along, the way that it's been going historically for the community. And finally, the most important part we want to make sure, and this is really a big part of our strategy, is that, the individuals that are most vulnerable and are being impacted the most is really where we want to address this funding and our efforts, as well as ensuring, basic needs for community members. So the third part of this is, what we're calling basic need or essential grants. For instance, the example being, the food bank and KSCS emergency food services. We wanted to make sure that, we injected some funds there so that there would be a sense of food security in the community. Everybody knows economically that prices are increasing, right? It's becoming, you're waiting longer at the store. And we don't want that to impact, those most vulnerable. So we wanted to stock up on essential supplies, and periodically during this COVID-19 situation, we want the ability to be able to address those needs for the community. Again, most important that if you're uncertain or you're worried about your income in the face of COVID-19, please contact client-based services. And then we are going to, assess what your needs are and determine the best program that you would be eligible for. And then if you're a business and you've been impacted, please contact Dewa Denizakta through business services. They've also provided a press release with some information that you can prepare for them in order to be able to address your specific situation. Again, the funding for this $9 million Economic Relief Measures Fund, for lack of a better word, this is, rainy day money that the council had set aside in its planning. These are reserve funds that were appropriated for social assistance, for emergency measures, for contingency. So, that's the type of situation that we're in. The council recognizes that there's an economic interruption occurring within the community, and is putting money on the table to address that through those reserves, as well as collaborating with Dewa Denizakta and using some of the Business and Economic Development Fund reserves to address small and medium-sized businesses, because we want the economy of the community of Kahnawake to remain strong coming out of this situation, and that's essentially in a nutshell what the purpose of the fund is for. So there'll be more communications coming out in the near future. But as an individual, please contact client-based services by phone or by email. And if you're a business and you've been impacted, please contact Dewa Denizakta, again by phone or by email. Thank you.
Okay, thank you, Paul. So there you have it. We have a system in place right now. We understand that it's been done as quickly as possible. So criteria, forms, everything, it's all developing as we speak. So don't take for granted that you might not fit in something. Find out, give us a call and ask where you apply, how you apply, and what category you would fit in, because we want to ensure that people have some relief in this pandemic. The funds are there and they're going to be distributed carefully. But at the same time, we got to get the people together. We got to get the teams together. We got to be able to filter all these calls. So be patient with us. It's an evolving process. So that's a bit of good news in all of this today. Thanks.
All right, now Gina and now Paul for an excellent presentation here. We'd like to thank all our speakers today. Lots of news on this daily update. As usual, we're here every day, roughly around this same time. We'll be back certainly tomorrow. Just one little bit of housekeeping. Speaking of client-based services, the staff at Client-Based Services is going to be calling all of the people who are receiving social assistance. They'll actually be calling, and they'll ask you to call their office back. That's being done for safety purposes, so you don't have any scammers trying to take advantage of the fact that there's calls being made. So you'll be contacted. You contact the office back at 638-0500. And they're going to instruct you on new ways of having your money processed by direct deposit, as one of the measures, again, for COVID-19. So that's one of the pieces of news that we have. And also, Joe Rodo, there was a release that went out earlier today and talking about doing the same thing while you're there. A lot of people are going there to kind of get away, but keep the physical distance there as well. A reminder, if you're using the water at the caretaker's cabin, please disinfect after you use. You get some wipes, when you shut it off, make sure the next person is safe. And that's the whole idea of everything that's being done here in Kahnawake. So we'd like to thank everybody for watching. Hi to all the elders, hope you're doing well. To anyone who's watching for the first time, we do this every day, and hopefully we won't have to be here too much longer, but we'll do our best to keep Kahnawake and everybody else informed every day. So take care, and remember, treat everyone you see as though they are infected, and therefore you should be keeping your physical distance. Take care of each other, and we'll see you next time. Wanagi wahi.